we can just chat about whatever.
Okay, that sounds good.
Okay, so is it recording?
It
Yes, it is.
it should be. It says recording at the top.
Okay, cool. All right, so first question is, can you just tell us a bit about your research, Dr. Song? What are you researching at the moment?
Okay, sure. So the research in my lab is focused on understanding the mechanism of our heart disease, including heart failure, arrhythmia. This is all my interest, and I have done research for more than 20 years, starting from NIH, and where I started a postdoc training there, and after that I came to University of Iowa for faculty for almost 40 years. Yeah, and so I have a pretty strong, solid training in the research related to ARVC, and that's why when actually I didn't do ARVC for a long time, but when I get into this field, I can catch it up very quickly.
Awesome. So what in particular are you working on at the moment? I know that there was some articles recently related to a protein called integrin beta 1D. Is that something you're still working on, or is that?
Actually, we are moving forward for that, because the integrin is the protein that is significantly altered in the ARVC patient samples, and it's an intermediate protein that related to the arrhythmia, arrhythmogenesis in a patient, in animal models, but more important, we found it's because it's hard to target the integrin protein directly, and instead we found it's important to stop the downregulation of the integrin from the upstream signal by inhibiting the ERK signaling. And with that, we found there are chemicals already available that's under clinical trial for other disease. And although no any specific disease, this drug have been approved for clinical therapy, but I think that we have a good high hope because this drug, this category of drug for ERK pathway is already preclinically approved in clinical trial. Stage 1 is proved is safe for patient, so that's a critical first step. Okay, so and now this category of drug is into the second stage for the other disease. And but we think this molecular, the change of this molecule in the ARVC is very critical for causing the change in integrin protein.
That sounds great. So are you confident that a cure can be found, and that possibly it will be found within a reasonable time frame?
Yes, I think I'm very highly enthusiastic about the possibility, because in our findings in the papers we show the ERK pathway is the upstream signal that's significantly upregulated in the ARVC human patients, in the ARVC cell line cell models. It's upregulated like threefold compared to in ARVC patients compared to other human disease like ischemic cardiac disease or dilated cardiac disease. This only increased by like 30–50%, but in the ARVC, the ERK activity increased by threefold instead of 50%. Yeah, this is that means this is ERG change. It's very unique in the ARVC, and that's why I'm very inspired and motivated to test the compound to inhibit the ERG pathway.
So how would that work? Would it be a like a drug that people take, or would it be like a stay in hospital, or some? How would it work, do you think?
Okay, once it's approved by FDA, by like any other administrators in other countries, and as long as it's available in a country, you can the doctor can prescribe the medicine to you, and you can take it just routine at home. You don't need to stay in the hospital. Yeah.
It sounds like that's something you would have to continuously take. It wouldn't be just a one-off sort of thing.
No, I think it's continuous because I think the unique things, this compound, we hope is not only treat the arrhythmia, but also stop or slow the progression of the disease. Because I found right now in clinic, I think you are very familiar, you know that there's no really good drug that can either for arrhythmia or for the progression of the disease. Basically, you know that it's just this the status of the heart continued getting worse, and then one has to get a transplant. And my hope is that this drug can be used to slow down the progression of the disease, and also in the meantime to reduce the arrhythmia happen.
Awesome. So, what is it tough to get funding for ARVC, and what is that causing issues, the funding side of things?
Oh no, it's also because I just came to this field, and of course this is my first time to submit the grant, and actually in 10 days I should know the outcomes of my application. But still, in the meantime, if I can get support from the outside community, especially the patient community, and that I will get me more motivated to push the research faster, and because I feel I have the obligation to do as quick as possible.
Awesome. All right, that's pretty much just the questions I had, Christina. So I guess we can sort of end the video bit there and just, I don't know, have a general sort of discussion.
Okay, and yeah, if you have other questions, please feel free to ask.